Hello, ladies and gentlemen. Welcome. Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. I've been practicing cardiology for more than 40 years, and welcome to your heart lectures. The feature presentation is what questions you should ask if you have been diagnosed to have atrial fibrillation. Atrial fibrillation is a chronic condition associated with irregular heartbeat where you see the beat intervals change from beat to beat, and the heart rate can range anywhere. The heart rate, here's the EKG of atrial fibrillation. The heart rate can range anywhere from 60 to 200 beats or faster, and the interval between each cycle is variable, and there is lack of atrial activity. So this is in a sense a chronic atrial fibrillation. Most of the time, chronic atrial fibrillation is related to the underlying coronary artery disease. It is also seen in patients with valvular artery disease such as mitral stenosis or mitral regurgitation. It can also be seen in patients with hypertension and heart failure and kidney failure patients. And atrial fibrillation, as I said, is a chronic condition, and there are situations where it can be cured with certain procedures, which I'm going to mention in a few minutes. So let us look at some of the things you should be asking when you see your cardiologist or the primary doctor with a diagnosis of chronic atrial fibrillation. There is another term called paroxysmal atrial fibrillation. That is, sometimes you get a period of irregular heartbeats which represent atrial fibrillation, and at other times you may have a normal rhythm. The only way to find out that would be to put a 48 hours or 14-day monitor to see how often the rhythm changes from being normal to abnormal. And how is it treated? When we are talking about treatment of atrial fibrillation, there are many things that we need to take into consideration. Number one, control of rate, because if the heart rate is going 200, we need to control the rate. Then we need to try medications to see if we can bring the rhythm back to normal. That is the rhythm control. After that, we have to make sure that we improve the quality of life in patients with chronic atrial fibrillation. Do I need to take blood thinning medications? And why do you have to take blood thinning medications? Because atrial fibrillation has irregular rhythm in the upper chambers, there is a tendency for blood clot formation in the left atrial appendage, that little pouch, and from there the blood clots can go to the brain or to the other parts of the body. And in order to prevent that, patients are put on blood thinners. The most frequently used blood thinners are, of course, warfarin, or there are other medications that can be used without having to do any blood tests regularly. When you're taking these blood thinners, there's always a chance of bleeding. The next question people may ask is there any way I can do without taking blood thinners? Well, as long as you have chronic atrial fibrillation, there is an increased risk of stroke from blood clot blocking one of the arteries. But there are situations where we may be able to get off the blood thinners by using certain procedures known as radio frequency ablation. That is, catheters are placed in the heart upper chambers, and they are treated with radio frequency waves to terminate this atrial fibrillation. It's a pretty long procedure, and the success rate is between 60 and 70%. And in those patients, if their heart size is fairly normal, they can come off blood thinners, but still they may need to be on aspirin or some other medication to prevent any clot formation. Okay, let's look at the next set of questions. What should I expect my medicines to do? And as I said, there are medications which are used to control the rate. For example, like a beta blocker, metoprolol, or a calcium channel blocker, or digoxin. So these are some of the medications. And for chronic control, we may use amiodarone. And all these medicines have side effects, and when they are combined with other medications, there's always the issue of interaction with other medications, which we need to be concerned about. Medicine side effects can make some things worse, and that's why there's got to be a delicate balance between controlling the rate, rhythm, and minimizing the side effects. How effective is radiofrequency ablation? As I said, the radiofrequency ablation, the patients have to be suitable to begin with. If they have grossly enlarged heart and they had this atrial fibrillation for a long time, the success rate may not be as good. But generally speaking, the success rate is 60 to 70%, where we will be able to get rid of the atrial fibrillation, and in those patients, we can take them off the blood thinners. And I answered this question. Next, will I need a pacemaker in the future? This is a very good question, because patients with atrial fibrillation have very rapid heartbeat, which is irregularly irregular. It can range anywhere from 60 to like 200 or 250. But there are times when the heart rate may come down because of the intrinsic problem with the sinus node, or because of medications used to control the rapid heartbeat. So if you're giving medications to control the rapid heartbeat, it also can decrease the heart rate lower. As a result, the heart rate may drop to like 30s or 40s. And if the patient is symptomatic, then there is a possibility that patients may need a pacemaker to control the slow heart rate, so they can give enough medications to control the rapid heartbeat with atrial fibrillation. Why does the heart rate speed up from time to time? This is another excellent question. Even though you're on medications, your heart rate is reasonably controlled, like less than 100 beats. But from time to time, the heart rate can just jump without any explanation to 180, 190. And it's just the nature of this arrhythmia. And it also goes up during fever, during infection, during anxiety, or anything else, changes in your electrolytes. They can create a rapid rate. And that's why you need to be checked very thoroughly on a regular basis. What can I do to slow the rate down? This is an important question, because you're on medications, and as I said, from time to time the heart rate can jump to 150, 160, 170, 80, and when that happens, you should have some leeway to either take an extra dose of a beta blocker or something like that to bring the heart rate down. That's where you need to sit down with your cardiologist and come up with a game plan. What happens if my heart rate goes beyond 150? What medications can I take? How much can I take? How often can I take? And these things will help you to keep you from visiting the emergency room. My pulse rate is too slow. Is that bad? Yes, indeed. Let's say you are monitoring your blood pressure, which records the blood pressure and pulse, and you have a history of atrial fibrillation, you're on medications, and you do the blood pressure check, your pulse rate may come down as 40. There could be a couple of reasons where the pulse rate may be slower than what it actually is, because the monitor may not pick up some weak heartbeats. It won't pick up some extra beats like PVCs. As a result, the actual rate may be slower, but when we do an electrocardiogram like this, we will be able to pick up the actual rate. So if things are happening this way, then we usually put like a 48 hours or a 14-day monitor to see how slow and how fast the heart rate changes in a patient with atrial fibrillation. Okay, now let's move to the next set of questions. Will atrial fibrillation weaken my heart function? Atrial fibrillation can weaken the heart function, especially in patients with a stiff heart muscle or thickened heart muscle or hypertrophy. And so in patients with hypertension, or in patients with hypertrophic cardiomyopathy, or in patients with aortic stenosis, the onset of atrial fibrillation can worsen their heart symptoms. They can go into heart failure. And that's why it is important to control the atrial fibrillation and see if we can convert that into a regular rhythm. What lifestyle changes I need to follow? Basically, atrial fibrillation is a reflection of an underlying condition like coronary artery disease, hypertension, valvular heart disease, or any other like a cardiomyopathy. So we need to focus the importance on the symptoms related to the atrial fibrillation, either just related to the slow rate or the rapid heart rate, or its effect on the heart function, which may be affected. Will it make me weak and tired? Yes, indeed. Atrial fibrillation can make you weak and tired because when the heart is pumping from the upper chambers in a normal situation, it is able to pump a good amount of blood. But with atrial fibrillation, the upper chambers are not able to pump adequate blood. As a result, the blood going from the ventricle into the rest of the body may be decreased. That is a decrease in cardiac output. When the heart output is decreased, that can make people weak and tired. What is my prognosis? Prognosis is generally good because atrial fibrillation is a chronic condition. It is associated with coronary artery disease, hypertension, valvular heart disease, and heart failure. Generally, by controlling these underlying conditions, people should be able to function normally, even with the chronic atrial fibrillation. And as I said, with radio frequency ablation, we should be able to get rid of 60 to 70% of the cases with atrial fibrillation. There's one more situation that we can consider, that is like blocking that left atrial appendage with a device, so there's less chance of blood clot formation, and when that is successful, then we may be able to take these patients off Coumadin. So does caffeine and alcohol affect atrial fibrillation? Anything that stimulates the heart can increase the heart rate. So caffeine and alcohol can increase the heart rate, and it depends upon how much caffeine you're taking. If you're drinking 12, 14 cups of coffee or tea, it may have a more significant effect. How often do I need to follow up? I think you should follow up with your cardiologist every 3 to 6 months. Make sure your heart rhythm is controlled if possible, or at least the rate is under control, and it is not causing significant symptoms because of the irregular rhythm. Let's say you go through a radiofrequency ablation and you want to know if you're in regular sinus rhythm. How do you find out? The only way to find out is to put you on a 14-day monitor and see how often does this atrial fibrillation come back, or whether your rhythm remains in a regular rhythm. And I mentioned about what you do if the rate speeds up. As I said, most of the cardiologists may recommend to take an extra dose of a beta blocker or a calcium channel blocker to bring the rate down. But more importantly, we need to find out what is triggering the rate. Is it fever? Is it infection? Or is it related to any blood loss? Things like that. So ladies and gentlemen, this is a quick overview of atrial fibrillation, which is an important aspect of cardiac problems that we deal on a regular basis. It is the most common arrhythmia we see in patients with coronary artery disease, hypertension, and heart failure, or valvular heart disease. And this is something that has to be taken seriously and has to be appropriately managed in terms of rate, in terms of rhythm, in terms of anticoagulation, in terms of quality of life, and in terms of improving the survival. Thank you so much, and we have many topics like this on different areas in cardiology, please do watch them, and please do subscribe to our YouTube channel. I will see you in the next video. Thank you.